Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before we get to today's update, I want to remind Albertans about a change we recently made to variant screening. As I've previously said, variants are now and will continue to be the dominant strain in our province. I also said a number of weeks ago that by now we should all assume that every new case is a variant of concern. With cases rising, our labs have had to adjust their testing strategy and are no longer screening every sample for variants. This frees up crucial lab capacity to ensure that people get their COVID-19 test results back as soon as possible, which is the most important thing we can do with our lab capacity to minimize further transmission. Our labs will continue monitoring the spread of variants. They are screening a representative sample of positive cases every day for variants of concern. This includes continuing to screen cases associated with outbreaks, healthcare workers, and returning travelers, among others. We will also ensure that samples are representative of all areas of the province. This approach is similar to what other provinces have been doing for many weeks and helps our labs focus on what matters most, testing and delivering results as soon as possible. This change means that contact tracers will no longer be notifying confirmed cases and their contacts that they have been exposed to a variant. Everyone will, of course, be notified as soon as possible that they have tested positive or have been exposed to COVID-19. All close contacts must continue to quarantine for 14 days from the day of their last exposure. This is the same for all cases. As you know, the last day of exposure for household close contacts depends on whether the confirmed case is able to safely isolate away from other household members. I would like to remind all Albertans that if you cannot safely isolate at home, you can call 211 to get help with other options. Turning to today's update. Over the last 24 hours, we have identified 2,211 new cases of COVID-19 and completed about 19,900 tests. Our positivity rate currently stands at 11.1%. There are now 654 people in hospital being treated for COVID-19, including 146 in the ICU. I am pleased to report that there were no new deaths in the last 24 hours. We have now administered more than 1.73 million doses of COVID-19 vaccine. This morning, bookings opened for all Albertans born in 1991 or earlier. Over 100,000 Albertans have already taken advantage of this opportunity, and on Monday, bookings will expand so that anyone born in 2009 or earlier can get their shot. This means that starting next week, everyone who is turning 12 this year and older will be eligible for vaccine. That is incredibly exciting, and I urge all Albertans to book as soon as they can. At the same time, I am also asking for your patience. Come Monday, there will be more than 3.8 million people now eligible. AHS and pharmacies are working diligently to schedule everyone, but it will take some time to get all first doses booked. If you don't get through right away or can't find an appointment immediately, please try again a few hours or a few days later. Also, if you book more than one appointment, please immediately cancel the ones you do not intend to use. This frees up the spot for someone else who's looking for it. I know that some have asked why we need the new restrictions when vaccines are becoming more available, so I want to end today by talking about why these measures are needed. I recognize that these measures create a significant disruption in people's lives, and that accommodating these changes can be challenging. I know that any restriction can have its own impact on people's health, and I wish that these were not necessary. But they are. These measures are absolutely necessary if we are to reduce community transmission and stop cases from getting out of control. Our first and second waves showed us that uncontrolled spread can happen quickly, and the higher cases get, the harder it is to bend the curve back down and reduce the spread of infection in the province. This happened even before we were dealing with the more infectious variants. We don't yet know if we have hit the peak of new cases. Our provincial R value of 1.12 last week tells us cases are continuing to grow. That's why implementing these measures now is so critical. The spread in our province is extremely high, which means the risk of being infected is also extremely high. We all need to significantly reduce the number of interactions we have in person every day in every part of our lives. Cases have risen to the point that we cannot simply target one sector or group. Whether it is social gatherings, faith services, aesthetics locations, or fitness classes, each activity involves Albertans mingling in person and risks exposure to the virus. I know Albertans are tired, and I know we've been down this road before. But thanks to vaccines, we are seeing other jurisdictions bend the curve and keep it there. This will happen here too, as more and more of us step up to get vaccine and form part of a protective wall around our communities so we don't have to go through these types of widespread restrictions again. This is a challenging moment, but one we can get through and will get through by limiting in-person interactions as much as possible. By working together to embrace these restrictions, no matter how tired or frustrated we are, we can get COVID-19 under control in Alberta. Thank you all for your sacrifices over the next few weeks and for helping us all get through this third wave. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question is from James Keller. Yes, James Keller with the Globe and Mail. Go ahead, James.
Hi, thanks, Dr. Hinshaw. I'm just wondering, we heard from the Premier, these projections that we could be at the situation of, if we did nothing, of having ICUs full and implementing this triage plan within a month. How concerned are you that we might be headed in that direction? And the flip side, I guess, is how optimistic are you that these new measures can actually successfully avoid that?
We know that there is a lag between new cases and growth in hospitalization and ICU, but we also know that between the combination of vaccine rollout and the restrictions to drop the possibility of transmission between people, that the combined impact of those two things together can have a significant, and I anticipate will have a significant impact on transmission in the coming weeks. So those two things together, I believe, will be able to bend the curve so that we don't see that overwhelming of our healthcare system that I think was a distinct possibility if we had not been able to bend the curve back down with that combination of restrictions and vaccines.
James, is there a follow-up question?
Yes, and so given the lags, right, there's a lag between the restrictions and when infections start to go down in a couple of weeks if it works, and then another lag between when people get infected and are sick enough to go to the hospital. So I'm just wondering, again, just given that idea that, in a month we could be at this crisis point, how much of what is going to be happening in hospitals, 4 weeks or a month from now, is already just baked into the numbers, and there's not much we can do to prevent some of that?
Part of it absolutely is already a part of what has happened. Exposures that have happened will be driving our case rates in the next 1 to 2 weeks, and then those cases will be driving our hospitalization numbers in the few weeks following that. So part of it absolutely has already been set. However, we know that, again, as we're rolling out vaccines, part of the impact of vaccines is to prevent and minimize the chance of onward transmission and bring down our transmission rates. But part of the impact of vaccines is also to reduce the proportion of people who get infected who need hospital care by reducing the severity of illness for the small proportion of people who may become infected after vaccination. So really, again, it's those two things combined that are so critical at minimizing the chance that we could get to that point of overwhelming our healthcare system.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. I understand restrictions are still slated to ease at continuing care facilities despite the latest round of public health measures. Now, most of these seniors are fully vaccinated, but how come the province is still going ahead with that when there's a bit of a clampdown on most other things in Alberta?
The interesting thing about the update that we made to our visitor restrictions is that it allows local residents to have a voice and a say about the direction that they wish to take. So there were three main parts of what the updated visitor guidance did. So the first part was to allow each resident to designate up to 4 support people. So right now a resident can have 2 support people, and when this new framework comes into effect next week, then people can have twice that many. So up to 4 people who can come and support them, which again, we've heard for individuals in continuing care, this isn't just about social visits, it's about people who are a part of their care team and allowing more people to be a part of that care team. And so again, that's something that, as I understand it, is broadly supported, in addition to the second, which is essentially to allow outdoor visits to take place in a similar way to outdoor visits in any other part of the province, where we know that with distancing or masking plus being outdoors, the risk is greatly reduced. The third part of the expansion is indoor visits, which are more about that social visit construct. And that's where we have required that operators get input from their residents, and a majority of residents need to choose to go ahead with that indoor visitor movement before the facility will actually take that step. And so we believe that this particular framework allows residents in these settings where there is an extremely high vaccination coverage rate to be able to make that decision, so that if they want to hold off, absolutely a reasonable thing and one that those residents can choose to hold off on. And if there is a group of residents that wish to proceed with all of the other precautions that are currently in place with symptom and exposure screening, with PPE and a variety of other measures, that those residents in this particular framework are able to choose to do so. So it really is about enabling people in these extremely highly vaccinated settings. Again, I want to emphasize the reason that this is different than other social gatherings in other parts of the province is that the vast majority of people in these settings have been vaccinated, and all have had the opportunity to do so, and the vast majority have had 2 doses of vaccine. So again, for all of those reasons, we are allowing those residents to make the choice of whether or not they wish to ease that particular part of the restrictions.
Julia, is there a follow-up question?
Yes, there is. Thank you. On a slightly different topic, AHS says that the pause on up to 30% of non-essential surgeries will be indefinite. Do you expect the amount of procedures affected to increase from 30% to a higher percentage? And what has to be seen with case counts, positivity rates, etc., before this particular measure can be eased?
Alberta Health Services would be able to provide more details about exactly how they determine the proportions of surgeries that they need to pause, defer, or cancel when they're seeing pressures in the acute care settings. What I do know is that as we've been working with Alberta Health Services over the past year, AHS has done a remarkable job of ensuring that wherever possible, they do continue access to care for all kinds of issues that Albertans have. And so it was when there's pressure on the acute care system caused by the significant volume of COVID-19 inpatients that they have been forced to make these decisions. And so again, AHS would be able to provide more detail on exactly how those decisions are made, but it is related to ongoing pressures and is constantly assessed based on the volumes of cases that are translating into pressure in hospital and in ICU.
Operator, could you put through the next caller, please?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, good afternoon, Dr. Hinshaw. Both BC and Saskatchewan have discussed plans to shorten the interval between first and second vaccine doses in the last few days. Just wondering where Alberta is at with these intervals and whether we can expect to see our intervals between doses shortened.
What our plan has been and what we've communicated about our expectations for that second dose is that as soon as we are done offering first doses to all Albertans who are eligible and want it and have the supply, we will start offering second doses to those who've had those first doses. And so based on the fact that we have increasing supply coming into the province throughout the next several months, and we now, as you know, as of Monday, will have all those who are turning 12 this year and older eligible for vaccine. Once we finish offering to all those individuals, we will of course be moving on to second doses. So it's very likely that the interval will be shorter than 4 months. And I want to be clear that that 4-month interval was always a maximum. It was not a, we were never planning to require a wait of 4 months. It was really about, we would not have anyone go beyond 4 months, but if we can offer it sooner, we will. And as you know, that for certain groups who are significantly immune suppressed, we are already offering vaccine at the 21 to 28 day interval. And those individuals who are on active cancer chemotherapy, who've had a transplant, or on other profoundly immune-suppressing medication can call 811 to book their second dose appointment for Moderna and Pfizer products at that 21 to 28-day interval. For AstraZeneca products, the interval recommended is 12 weeks to get the maximum immune response. There is some evidence that having a second dose sooner with AstraZeneca can actually reduce the overall immune response, even over and above what a first dose would offer.
Jason, is there a follow-up question?
Yeah, certainly. On a slightly different topic, I know there's a lag time between cases and severe outcomes like hospitalizations and ICU admissions, but our case rates in Alberta were certainly high 2 weeks ago, and there's been very little change to ICU numbers over the past 7 days where we've really plateaued. Wondering why you think ICU numbers have stayed relatively stable over this past week.
What we have seen in previous waves is that ICU numbers can fluctuate day to day. And so when you're looking at, and when we're looking at trends, we're sort of looking at the average trends over time. We know that Alberta Health Services has been working very hard to ensure that when someone no longer needs that intensive care, that ICU care, that they're transitioned to another space to receive appropriate care in the hospital. And so there could be some element of, again, that appropriate mix of care for patients. We also know that a couple of weeks ago, we saw what seemed to be a bit of a plateau for several days in ICU cases, followed by several days of almost vertical growth, followed by another bit of a plateau. So again, the important thing is to watch the kind of average of what happens over time. And I don't think that we can assume that over the past few days, the relative constancy of the ICU numbers is a prediction of what we would anticipate would happen going forward, given our very high case numbers over the past several weeks.
Operator, could you put through the next caller, please?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, Dr. Hinshaw. Thanks for taking my question. I'm wondering, with the hospitals under such pressure and staff being worn out, what worries you most right now about the healthcare system?
I think a couple of things. One is certainly the knowledge that it's not possible to provide care for every issue, for every health issue that Albertans need care for. So COVID-19 is already disrupting the ability of the health system to provide, for example, scheduled surgeries in some instances, despite the best efforts of the health system to maintain that. So, of course, that's a concern because all of those delayed procedures, delayed access to care that's required right now to ensure that we have the urgent care for COVID can then cause impacts down the road as people's concerns and health issues continue to unfortunately worsen as they're waiting for that treatment. So one of the concerns is, of course, that many of these things being deferred will need to be dealt with down the road, and that will cause significant pressures. And of course, the other issue that I think is particularly impactful for those working in healthcare is the fatigue. And we talk about COVID fatigue, which I know all of us experience, but fatigue in those who've been working in these intense environments, day after day, week after week, month after month. And I think making sure that healthcare workers know that the work they're doing is valuable and important, and so I would ask all Albertans to consider ways that they can show their support for those on the front lines caring for the sickest patients with COVID-19, as well as those who are working every day to prevent spread in areas like the lab, like contact tracing, like the frontline environmental public health officers, those who are providing immunizations. So I really want to, again, express my gratitude for my colleagues in all of those different areas, and would ask all Albertans to recognize that as well, because I think when people understand that that hard work is being appreciated, it can help them sustain through this next difficult several weeks.
Carrie, is there a follow-up question?
Yes, thank you. And Dr. Hinshaw, what is Alberta Health or AHS doing to support those people that you just talked about that you were saying you wanted Albertans to help support? What extra is happening for them now?
I wouldn't be able to comment on Alberta Health Services. That would be a question directly for them. Certainly from the ministry standpoint, we have been I personally have been trying to send messages of support and gratitude, and making sure that the most important thing we can do is to work on our policies to prevent the spread of COVID-19, as we are doing, so that the pressure that the system is currently experiencing is going to ease over time, and we will be able to get back to offering the full range of services that Albertans need. So that is the number one thing we can do to support those frontline healthcare workers, is to do our part in minimizing spread, easing the pressure, and helping all of us get back to the place that we'd rather be in a more normal time.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Kevin Nimick with CPV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. Drumheller has 25 active cases, just under the 30 necessary to qualify it for the regional restrictions. But it's also a popular weekend day trip destination for Calgarians. Are you concerned for the safety of Drumheller residents if too many people visit?
I would strongly encourage, first of all, that as we are in this a very important time where we're minimizing the spread of COVID-19, I would encourage people not to travel outside of their home communities for recreational purposes, and to stay close to home if at all possible. And certainly it's really important that wherever people are, they're following the rules in place. Even in Drumheller and other places that are under that 30 active cases threshold, there are restrictions in place. For example, after Sunday, there will be no in-person dining possible in restaurants, and we will again be limiting the types of activities that are possible to happen indoors in those areas. So again, I just want to make sure that people are aware that even in those areas that are a little bit lower under that 30 active case threshold, there are still enhanced measures in place, and those measures need to be followed for everyone's safety.
Kevin, is there a follow-up question?
Yes. In April, Dr. Hinshaw, you spoke about threats that had been made against you by people angry about Alberta's COVID-19 response. Do you feel safe now?
I am well supported by the security team at the ministry, and certainly appreciative of all of the messages of support and encouragement that I've also received from Albertans. So want to thank those that have taken the time to reach out and provide those messages, because I know that while people are still angry and frustrated, the vast majority of Albertans understand that the current restrictions are necessary to protect our communities, to protect our healthcare system, and there are many who've reached out with that message as well, and I want to say thank you to them.
Operator, could you put through the next caller, please?
Yes, next is Jesse Wisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. As case counts remain high, are contact tracers shifting focus like they did in the fall to prioritize cases in high-risk settings? And if case counts continue at this rate, when could they become overwhelmed?
Alberta Health Services has done a tremendous job at expanding the capacity of the contact tracing and case investigation teams. And so they do have the capacity to be able to contact all cases within 24 to 48 hours of the positive test coming back, and to be able to do the investigation to determine some key facts about their close contacts and some of the other kind of key areas that they might have acquired disease. I know there's been some questions about whether close contacts are all being called, so I want to remind people that the process that happens when someone perhaps feels ill, they go for a test. That test typically is available. The lab's processing the tests through within about 24 to 48 hours. It takes another 24 to 48 hours to have that case investigation where the contacts are identified. So even with the current process where we are trying to have each step take no longer, ideally within 24, but sometimes up to 48 hours, it can take several days before contacts will begin to be notified. And so it's really important that all who are notified of a positive case also consider, if they're able to, notifying their own contacts, so those individuals can already start the process while they're waiting for that formal follow-up to occur. But AHS, again, has worked hard to expand capacity to be able to manage the current volume and still be able to notify all of those cases and all of those contacts. Again, want to emphasize some of the other important aspects of that. One is the AB Trace Together app, which has been upgraded, does have additional information over and above the ability to do that rapid contact tracing. That still is an important part of the system. And also, when a new case is notified, they have the opportunity to go online and start entering in information about their close contacts that then is verified when they get the case investigation call and can help with rapid and automated notification of their close contacts. So there are some technological additions to that process which can help speed things up and enhance the capacity of that team.
Jessie, is there a follow-up question?
Yes, thank you. The Premier told Albertans Tuesday to stay home if they can for at least 3 weeks, yet malls are open and non-essential businesses are open. I'm wondering why these services are open when people are being told to only leave home for essential reasons.
It's important, as we were looking at the different suite of policy options, to again consider what we have done in the previous rounds of COVID-19 response and the kinds of things that we learned from those rounds of response, and also looking at other places across the country and around the world. We know that the suite of restrictions that we have in place was effective in March, was effective in December. And when we consider some of those other retail outlets, it becomes quite difficult when you have a whole class of business such as retail to determine what is essential and non-essential, which was a significant challenge that we had about a year ago. And so again, want to remind everyone that there are further capacity limits in place on retail, that in malls, the common area in malls no longer counts towards the capacity calculations, so that the capacity is much further restricted in malls. And I would encourage all Albertans to consider following again the recommendation for only leaving home for essential purposes. And if there is something that someone needs to purchase, obviously groceries, there are things that people still need to purchase, to have only one member of the family go to purchase those items and to minimize the number of people who are out in those public spaces.
Operator, could you put through our final caller, please?
The final question is from Lisa Johnson with the Edmonton Journal. Go ahead, Lisa.
Hi, thanks for taking my question, Dr. Hinshaw. I just want to follow up on the question that Kevin brought up. In early April, Premier Kenney expressed some concerns about differing regional restrictions given there were cases across Alberta. He noted that there's some potential pitfalls. So I'm wondering, how does Alberta Health plan to address potential travel from high transmission areas to low transmission areas?
certainly, travel, again, from high transmission to low transmission is a concern. One of the ways that's mitigated is, again, recognizing that even in those lower transmission areas, pretty much all areas of the province are across that 50 per 100,000 threshold at this point in time. And so even in those areas where they are below that 30 active case threshold, we are putting in additional restrictions that limit the types of environments where people may be interacting with people outside their household. So there are some, again, I mentioned restaurants, restrictions like that will have some protective effect. I also, again, want to reiterate the importance of people staying close to home at this time. And finally, if we do see transmission crossing that 30 active case threshold, once that threshold is crossed, then those particular locations, those municipalities, will be entering into the enhanced restrictions category. And even if they drop below that 30 active cases, that doesn't release them from that suite of enhanced measures. So again, it's important for residents in those communities to recognize the importance of managing and controlling transmission, because if there is that increase, then those enhanced measures will apply in those areas as well.
Lisa, is there a follow-up question?
Yes, thank you. I'm wondering, so just to clarify, it's that these restrictions are so similar across the board that Alberta Health doesn't really see a concerning incentive for public defiance. In other words, traveling between areas. Is it partly that, and partly that these particular regions that are under lesser restrictions would have to change if their cases rose?
So again, the part of the mitigating factor is that many of the restrictions are similar. So, for example, again, people who may wish to travel to access a restaurant, that restriction will be identical across the province, and so that eliminates one of the incentives that there could be for people to travel outside their area. And the second piece is exactly as you say, that while we strongly encourage people to not travel outside or to stay close to home for the next several weeks to minimize the possibility of spread, we also know that transmission can happen even within those communities. So even if there is no travel, there could still be transmission that can bump them up above that 30 threshold. And so there is that incentive to keep the transmission low, to follow the public health protocols, and to make sure that whether it's from visitors who may come from outside or whether it's from those local residents, that the cases remain low, and that incentive to try to keep that low hopefully will again mitigate transmission and some of those risks from inter-regional travel.
Thank you all for joining us today. Dr. Hinshaw will provide another live update early next week. Have a safe evening.